Dr. Bruce Vander Hoff, Director of the Ohio Department of Health. Well, as the days and weeks pass, it becomes increasingly clear that not only are we leaving the Omicron surge behind us, but we're entering a new phase of our experience with COVID-19. Case numbers and community transmission have continued to drop steadily, as have hospitalizations. Indeed, all but 10 of our counties now have low or medium community levels, according to the CDC. The 10 counties still at high levels include Ottawa to the north and 9 counties to the south, generally along the Ohio River. At one point in January, Ohio had more than 2,200 cases per 100,000 residents. Now our state average stands at 78. That's the lowest level we've seen since August. Similarly, while just 2 months ago, our hospitalizations were topping 6,000 people, today, fewer than 800 are hospitalized with the virus. Now, many communities, schools, and businesses have responded to these changes by relaxing masking and social distancing and other restrictions. Maybe you've allowed yourself a sigh of relief, and understandably so. The situation is improving, and our experience with COVID-19 is evolving from that of a pandemic to more of an endemic state. Reflecting these new realities, beginning on Monday, the state of Ohio will shift its reporting of COVID-19 data from a daily to a weekly cadence. In fact, Ohio has been one of only a handful of states still reporting COVID-19 data daily. Cases, hospitalizations, ICU admissions, vaccinations, which are all currently reported daily, along with deaths, which are reported twice weekly, will be reported each Thursday on our dashboard at coronavirus.ohio.gov. Likewise, data from our long-term care facilities and our partner agencies will also move to weekly postings. Now, all the same information will still be found on our dashboards. The only change will be the frequency of our updates. Now, even with this change, our state team will continue to monitor the trajectory of COVID-19 very closely. We'll continue to update our data, and we will continue to have close surveillance to help us monitor COVID-19 activity and to identify pockets of higher spread so we can work with local communities on timely responses as needed. Now, one reason for this shift is to better align Ohio with the new benchmarks established by the Centers for Disease Control and Prevention. Indeed, as you may recall, CDC's COVID-19 community levels, which were announced February 25th, moved away from relying on these daily case numbers as the sole measure of risk. Now, instead, the CDC is focusing on the severity of illness in a community, as reflected by the percentage of hospital capacity that's devoted to caring for COVID-19 patients, as well as the number of new COVID patients admitted to hospitals over the past week. In this model, new case counts averaged over the past week represent one prong in a three-pronged approach to risk assessment. Now, what's helpful about this new model is that it paints a combined picture of both the rate of spread and the severity of illness. That kind of picture is particularly important for an endemic respiratory illness that tends to ebb and flow, like COVID-19, or even influenza or the common cold. For example, we worry a lot about a wave of the flu that's landing many people in the hospital, even if a cold virus is circulating at the same time, infecting more people but causing no hospitalizations. Thus, our COVID-19 community level allows us to judge the overall impact of COVID in any given county. Now, looking at the community levels in Ohio this week, 61 of our counties are at low risk, 17 are at medium risk, and as I noted earlier, 10 are at high risk. Knowing the COVID-19 community level in your area can help your community and you as an individual identify prudent prevention measures in light of your own personal health situation. Based on our most recent community levels, the recommendations for masking have changed a good bit, and in fact have decreased for much of our population. In counties with high risk, the CDC still recommends masking indoors in public, regardless of our vaccination status. And no matter what the community level of transmission, we need to remember that there are many people among us who are at increased risk, such as those of advanced age or even the immunocompromised. And they may still want to consider wearing a high-grade protective mask, such as an N95, when they go to a public indoor setting. Now, rapid tests are more available than ever, including for free in many libraries and community centers. So don't hesitate to get a test if you think you might have symptoms of COVID-19. And if you're in a high-risk category and you test positive for COVID-19, consider talking to your doctor or healthcare provider about whether one of the currently available COVID-19 treatments might also be a good fit. The state's supply of these therapeutics, including the oral drug Paxlovid, is still somewhat limited, but we have adequate supply for those in vulnerable populations. Thankfully, we do expect the supply of these COVID-19 therapies to continue to improve, and we hope that the drugs will become an ever more important tool in our COVID-19 toolbox as we move forward. Now, of course, getting vaccinated and staying up to date with vaccination continues to be the safest and most predictable defense that we have against this virus. To date, more than 7 million Ohioans have started their vaccine series, and that's very good news. But that also means there's an opportunity for many eligible Ohioans to potentially benefit from the protection of vaccination. Now, of course, keeping our vaccination series up to date means a booster dose for many of us. And a growing body of evidence suggests that a third dose does indeed provide a powerful boost to our immune system's B and T cells. And it's these important cells in our immune system that really are the foundation of robust protection from serious illness from COVID-19. And it appears that these cells, fortunately, have memory that can last for many months or possibly even for years.